medicine in Bulgaria in Plovdiv Medical University after working as a physiotherapist. She graduated in 2020 and has been working in the NHS since as a local medical SHO. She enjoys teaching and she documents her journey via social media. And she's currently in the process of applying to GP training. Just to let the speakers know, you have your full-time and also, just so that everyone's aware as well, we are recording and you will find that the recording stops at the end of each talk and then starts again, just so that you're aware about that and you're not annoyed about it. But yeah, thank you so much. Over to you, Dr. Priti.
Thank you, and good morning, everybody. So I'll just share my screen and then we'll get started. So I'm going to be speaking about preparing for the NHS as a medical student. So let's get straight into it because there's a lot to cover. So how early can you start? There is no right answer here. You know, you can start from first year. I'll be covering a few things that you can be doing from day one, and the things that are more suited to your clinical years, which typically are year 4 to 6 if you're studying in Bulgaria, Romania, and certain other European countries. So let's get straight into study tips. So I think the main thing that I want to stress is understanding UK guidelines. These are really easily accessible online. You can use NICE CKS. So if you just type that into Google, NICE CKS, you will come up with a screen like this. They go through all the different sort of clinical conditions with a step-by-step breakdown from diagnosis, management, the first line management. And these are our up-to-date guidelines that we will be using in the UK. Just to make a note, it is sometimes tricky to access it from abroad. You may need to use a VPN, so don't be surprised if that happens, but that's quite simple to sort out. But yeah, so I really recommend using these once you do get into clinical years. Familiarise yourself with this website because you will be using it once you start work as well. And I guess the thing with this is if you start, the earlier you start and the more familiar you are, it'll just be that bit easier for you when you are in your clinical years. You're not seeing information for the first time. And when you're preparing for the UK MLA, or as I am the MSRA now, it is just using this information again. So definitely familiarise yourself with this website. The other thing is question banks. So you may or may not have heard of Past Medicine, QuesMed. There's a few others as well, Past Tests. These are great, and I wish I started earlier. So Past Medicine, again, you know, it's about when can we start with these things when you're studying medical school? There's already so much going on. I think these question banks are quite nice to have earlier on, so it's not a shock at the end. PassMed are great. They have a preclinical pack as well. This is the medical student pack, years 1 to 3, and that one's free for 12 months. So I would use that one when you're studying anatomy. That was my personal preference. And as I said, it's free for 12 months, so it can complement your studies. On the right, you've got the medical student finals pack. I did use this through my clinical years, which is years 4 to 6. I used it more so in 6th year. Again, I just wish I used it a bit more than I did. And I'll tell you why. I'm studying for the MSRA at the moment, which is a GP entrance exam. And a lot of it is based on medical student finals. Now, for a lot of you who study abroad, I'm sure you'll relate that we aren't tested in the same format that our UK peers are. You know, it's not this quick fire and OSCE style examination, whereas these exams that we'll be sitting in the UK are. Now, if, for example, or when you start studying for cardiology or gastroenterology, for example, if you could complement that with these question banks, I think that'd be really beneficial. Again, I only really buckled down with this in 6th year. And I found it more difficult then because there was so much content, and these questions are in a style that, again, we're not familiar with. We may have learned it in, you know, essay format or for our oral exams and in that kind of style, but not necessarily like this. So I really recommend familiarising yourself with Past Medicine or QuesMed, whichever one you choose to go to. earlier, sooner rather than later. I just think it's really beneficial, and it'll help you with your UK exams as well. So books and resources. Now, I'm sure many of us will start medical school and we enter clinical years and we, want to buy all the books. And I myself are guilty. I've got Kumar and Clark and all my anatomy books sat on my bookshelf. I can't say I've managed to get through the bulk of most of them, because we end up using different resources. I found for myself, the Oxford handbooks were great. They're very small and compact. Again, these are more for your clinical years. And even when I was on placement in the UK, they're a great reference point if you enjoy sort of reading books. What I found I used more though were the online resources. So Osmosis, Geeky Medics. I have put the websites here, and I believe you will get a copy of this presentation, so don't worry about jotting everything down. Osmosis, Geeky Medics, and Zero to Finals all have websites, but they're also on YouTube. They provide a lot of great UK guideline-based content. Geeky Medics are fantastic. They go through your assessment, your sort of clinical assessment, what questions to ask, what special tests we'll be looking at. It's really broken down in a systematic way, in an OSCE style of going through it as well. So I really recommend familiarising yourself with them websites. And if you can start your assessment and start thinking in this way, what questions do I need to ask? What do they lead to? What are my practical tests? What investigations am I going to do physically? What can I suggest later? And you can familiar yourself with that, speaking through with your colleagues or in small groups. That'll be really beneficial. The next thing, we've got flashcards. So Anki and Quizlet are usually the ones that you'll see. There's hundreds of YouTubes explaining the benefits, or which one does which better. They're both great. I have tried to use both of them. It didn't really work for me as well, but I know plenty of people who have used them and swear by them. You can actually get preset medical decks where you don't need to necessarily input the information yourself. You can take somebody else's and use them flashcards online. I prefer to write my flashcards out. So whatever works for yourself, but these two are great from my colleagues who have used them. And we've got apps. So I love my apps on my phone. There are some really great ones. Medical Flash Notes is really succinct. Again, it incorporates them nice CKS guidelines that we're trying to familiarize ourselves with, but it's short, snappy information. I really enjoy having that on my phone on placement as well, just for that quick boost of information. Because sometimes if you try and search something, you're met with hundreds of, bits of information, and this is just very short and to the point. BNF, this app definitely gets on your phone. We use that so much during work as well to check, what the side effects are of medications. Are there any contraindications? Again, once you start getting into that habit, it'll just become a second nature for you. MD Calc, if you have or haven't have heard of it, is great. We use that mainly for things like if you're looking at the Wells score or a curve score for pneumonia or orbit for atrial fibrillation, it'll give you a breakdown and you can just input the patient's demographics or data, and it'll give you what the score is and what that means. Again, these apps are really good. It just saves you going on the internet and opening up lots of tabs and searching for things. There's loads more apps. Pocket Doctor, Ask to See Patient. So, you can end up with 20, 30 apps and not really use them. That's why I highlighted these three as the ones I probably do use and still use whilst working. But do have a little look, especially if you're like me and you like to have things on your phone. I've just put in the bottom there the Forest app. You may have used this before. It just sets a 25-minute timer where you shouldn't really be going on your phone, and you have a 5-minute break and then you start again for 25 minutes, just for that 25 minutes of focused time. That really helps me because I feel sometimes we have so much content and it's a bit overwhelming. Where do I start? And that 25 minutes stops some of the procrastination and worry, and I can just get it done for 25 minutes, have a break, reevaluate and go again. So that's a great app, and that one's free as well. So courses and societies. I wanted to touch on this. BMJ online learning. When I signed up as a student, I believe it was free or very cheap. But it's great. I did use this quite a lot when we came back. When I graduated, I completed quite a few BMJ online learning courses. And this is what the page looks like. And they've got quite a lot of free ones once you do sign up. There's a great ECG skills one, and various other ones that go through, again, using the guidelines, the different specialities. So check that out. If you're in clinical years, I think it's great for your CV as well under the courses section. It does give you CPD points as well. And it looks, I think it does look good because you're proactively trying to understand and familiarize yourself with the UK guidelines. Again, as Trevor was saying, it rather than just saying up to date with UK guidelines or reading about UK guidelines or however you'd word it, show that you are proactively doing that. And I find the courses are really good on here. The ECG one is quite long. I believe it's more than 10, it's about 10 hours, but it's really broken down into different sections, and I benefited from that. So that's definitely one to have a little look at. And the simulation centre. So I wanted to mention this. Again, it'll vary uni to uni, but see what your simulation centre at uni is doing. I know we had quite a lot of courses or things that were on, and you'd need to buy a ticket and you could attend. So be proactive and find out what is going on at your medical uni, and if not your medical uni, what's going on at one of the other medical unis wherever you are studying. If you're studying Plovdiv, maybe what's going on at Sophia, and there's usually something going on that you can get involved with. So do find that out. That information is usually available on Facebook or on the university's websites. So this is again back to what does your university have? And I will speak about Plovdiv. That's where I studied in Bulgaria. There's quite a lot of societies. These are the Instagram handles of a few that I do follow and have been involved with. And they're great. So, for example, the OSCE societies and Peer Medic Surgical Society, they're all looking at the UK guidelines because there were a lot of UK students in these unis and what we need to be doing to get back there. How can we prepare ourselves to get back to the UK? What skills can we build on? And I think it's great in that group environment where you can really just bounce off each other. And again, any learning that you do, anything that you attend, you're building your CPD points as well. It can go on your CV. Many of these societies provide you with certificates, etc. So get involved with all these things. And I just want to mention, if the society isn't there, you can always create one. So when we were studying, there weren't actually many societies, and one of my peers did found the OSCE Society, and we were involved with the starting up of that. And it's completely possible. So if there's something that you want to create, if you would like to see that society, it's more than likely that somebody else would as well. And again, all these things will go on your CV. Even getting involved with teaching, you can always reach out to some of these societies and get involved with the teaching. And you may feel, well, especially at the beginning when I was teaching, I felt I'm a student as well, and what can I offer at this point? But you do have a lot to offer. You can, and I feel it helps to consolidate your knowledge as well by approaching these societies and offering yourself to teach a specific subject or topic. So that was about societies. And social media I wanted to touch on. So there's quite a lot going on social media these days. I can't say I'm the biggest fan of social media, even though I do have my own page where I try and answer your questions and support you. I know how challenging it was graduating from abroad, and the information out there wasn't necessarily clear, and that's why conferences like this are great. But there's a lot of Instagram pages of us UK doctors trying to document our journey, show you what the realities are and support you. And there's also quite a few good pages. So I wanted to touch on 6 p.m. series. There's a few here that you can look into. 6 p.m. series is great. It's run by a group of UK doctors, and they will run these sort of long courses every month, every other month, and get speakers in. And it's just great to get involved with, because as you can see, over that sort of 2-week period, you will have gone through so much just by attending these 6 p.m. sessions for an hour. And again, that's going to reinforce these guidelines for you and maybe touch on things that you will not learn from a textbook, and it'll be people's real life experiences and things. So really recommend that you get involved with these. Again, it's written here, this is a snippet from their Instagram, but you can see it all on Facebook as well. And you will get a certificate as well of attendance for these things, and these things go on your CV as well. This is just another example from Oski. Again, you can just see how over a month, they're covering sort of renal, hepatology, neuro, endo, hematology, and you're just going to get that information for just putting away 2 hours of your time, and they're all online sort of webinars. So there's quite a few things to get involved with here, and you don't have to attend every single one. We know you've got other commitments, but even if you can have it on in the background, more than likely you will gain something. I understand that quite a few of these things are more suited to your 4th year onwards. But again, the earlier you do these things, the better, really. I think since COVID, they've become even more prominent, these sort of online webinars and lectures, which is great because it means that we can access it from when we are abroad and studying. So we can talk about clinical attachments. I won't go too into detail about this because I believe somebody else, or we will be touching on it later in the session. I do get a lot of questions about when can we start clinical attachments? And really, you can start from after 1st year if you want. I do believe you'll probably get the most out of it during your clinical years, the 3rd, 4th year onwards. But then the workload is also more as well. So you can start sort of earlier on. So the thing, it is quite difficult to find an attachment at times. Usually you need a consultant to supervise you. But the BMJ does offer good guidance on this and how you can go about it. It's free information available on the website, and there's other websites like Link Medics as well who can support you through this. The way I did it is I sent lots and lots of emails on my to finding consultants. So I'd go on a website, the trust website, find which consultants I was interested in, which, under certain specialities, for example, TNO, find who the consultant lead was, and drop an email, explain who you are, what it is that you're trying to do. I'd arrange them over summer. And usually you'll find them more than willing to help. I found it worked better emailing consultants directly rather than HR, but equally you can ring the trust, ask to speak to HR, and they are usually quite helpful. Few things to consider. Often they may be paid. So clinical attachments are usually anywhere from 2 weeks to a month or 2 months. They may be paid attachments, but there are still a lot of free attachments available. You just really have to send a lot of emails and do a lot of digging. Do consider as well that you may need to travel and fund accommodation, though some hospitals will provide you with hospital accommodation as well, which is quite helpful because it's often quite cheap. And the other thing to consider is immunizations. You will usually need to have your full vaccination history available. Now, this is something that you do need to think about from 1st year onwards. I know our uni in Bulgaria didn't really emphasize the need for this. And I was quite lucky I had all my things sorted from my previous degree. But do contact your GP, check your vaccination history, because these things can be quite time consuming. So the last thing you want to do is organise this attachment and then you're asked for this paperwork, and now you need to try and contact the GP and it takes time. So try and get your vaccination history from your GP, see if anything's missing, and do get the gaps filled sooner rather than later. Because again, the last thing you want to do is not be able to go on an attachment that you've organised because you don't have the correct vaccinations and immunisation record. So there's another way to gain NHS exposure. I'm aware not everybody can complete an attachment over summer, especially if it's going to be, moving away from home or family or other commitments. And sometimes they can add up in terms of cost if you've managed to secure one on the other side of the UK. There are always posts for healthcare assistants, phlebotomists, for example. There's always a shortage, and it's a great paid way to get exposure. You get a lot of hands-on skills, and you get that insight into what working as in the NHS is. I think it's also great that you can build connections, you can network, and when people know you're a medical student and actually, you're doing this to gain exposure, it does show that you're proactive and you really are willing to try and learn. And you can talk to the doctors there, you can maybe network, meet some consultants, and it may be that foot in the door that you need to then organize an attachment and have that help and support. Often, if somebody wants to join a ward round for their learning, it's rarely that they won't be allowed to. We've had some medical students come through who are working as healthcare assistants, and we're more than happy to help and support and teach where it allows. You can always stay after work as well if you have the time, I understand, and just spend that hour with a nurse or a doctor and see what their job is about. And again, it just gives you that exposure of what it's like working in the NHS. And just wanted to touch a bit on the other things that you can be doing. So audits, as Trevor mentioned, it's always great to have that audit and research section on your CV. Now, when studying abroad, I understand there's not usually a dedicated audit department or research team. Again, that's something maybe you could create if your university doesn't have that. I did manage to organise an audit when studying in Bulgaria and Plovdiv, and what I found is, once speaking to the departments, they're usually more than happy to support and get on board, because you're doing something that will benefit their department. There's lots of information online as to how to complete an audit and how to re-audit and things. So even if it's not been done before, it's definitely something that you can do. And again, it will look great on your CV. Research, again, we've mentioned, you can get involved with that. And be proactive at university. I feel, even though sometimes placements may feel, I did feel sometimes I wasn't getting as much out of it that I wanted to. If you speak to the consultants and your teachers, they are often more than happy to help if you show that interest and give your time. And there's a lot more that you can do, even if it doesn't feel like it when you're in the middle of it. So one thing that, comes with being proactive at uni, F1 competencies, I think it's really important once you start your clinical years to access and try and complete these competencies. There won't be somebody, especially not at our uni, that will be on your case, I guess, to say, we don't have this checklist of things that we need to do necessarily, especially not through the clinical years. Through 6th year it will be, but you can start this from clinical years. What I found is, speaking to the consultants again at some of the university hospitals, they were more than happy to direct you to the group of nurses or the phlebotomists and, introduce you, and you could stay with them and take bloods and put cannulas in, and they're great to learn from. So that is something that you can be doing whilst you are there. This page is just taken from the Oxford Handbook. So you can just see here, you've got things like cannulation, giving fluids, ABG, blood culture, and you can just print this off and just make sure you work through it.